The broadcast of the regular meeting of the Public Health and Safety Committee will now begin.
Good afternoon and welcome to the regular meeting of the Public Health and Safety Committee for March 18th, 2021. I'm Steve Fletcher, the Vice Chair of this committee, filling in for Chair Philippe Cunningham this afternoon. As we begin, I'll note for the record that this meeting has remote participation by members of the City Council and City staff as authorized under Minnesota Statutes Section 13D-021 due to the declared local public health emergency. The city will be recording and posting this meeting to the city's website and YouTube channel as a means of increasing public access and transparency. This meeting is public and subject to the Minnesota Open Meeting Law. At this time, I'll ask the clerk to call the roll so we can verify a quorum for this meeting.
Councilmember Gordon. Councilmember Ellison. Councilmember Cano.
Here.
Councilmember Palmisano.
Present.
Councilmember Cunningham. Councilmember Gordon. Councilmember Ellison. Councilmember Cunningham. And I'll come back to Councilmember Gordon.
I am here.
And Vice Chair Fletcher.
I am here.
There are 4 members present.
Thank you. Let the record reflect we have a quorum. And with that, the agenda for today's meeting is before us. We'll begin with the consent agenda as follows. Number 1 is authorizing a grant application to the United States Department of Health and Human Services for resiliency in communities after stress and trauma. Item number 2 is Minnesota Department of Health grant for the Safer Sex Initiative project, accepting a grant from the Minnesota Department of Health. Item number 3 is Princeton University grant for a Minneapolis Food Action Plan, accepting a grant from Princeton University and authorizing an agreement for the grant funds. Item number 4 is a grant application to the United States Department of Housing and Urban Development for the Older Adults Home Modification Program. Is there any discussion on the consent agenda, or are there any items that anyone would like to pull off for further discussion? I see Councilmember Cano.
Thank you, Councilmember Fletcher. I would like to pull out the item, the recast item. I have a couple of questions about it. I'm going to vote in favor of it, but I just wanted to discuss it really briefly here with colleagues and the public, given the great sensitivity around 38th and Chicago and the deep need for trauma response. So if I could do that, please, I would appreciate it.
Very good. Item number 1 has been pulled for discussion. Are there any other items that anyone would like to pull for discussion? Seeing none, clerk, please call the roll on items 2 through 4.
Councilmember Gordon.
Aye.
Councilmember Ellison.
Aye.
Councilmember Cano.
Aye.
Councilmember Palmisano.
Aye.
And Vice Chair Fletcher.
Aye.
There are 5 ayes.
That carries, and the consent agenda is approved, and we'll return now to item number 1, which was pulled for discussion. Councilmember Cano.
Thank you, Mr. Chair. So if city staff who are leading this initiative could please be ready. My questions pertain to the current work that this program or initiative is able to do right now for people who are experiencing deep stress and trauma and shock at 38th and Chicago. I know that we've been meeting about it, and at the last briefing about a day or 2 ago, I completely forgot to bring it up at that meeting, and was really glad to see it on the agenda today, because these resources are quite large. This is a pretty significant grant, for potentially a 5-year grant, $1 million each year. So it would be great to hear how those resources are being deployed to the needs at 38th and Chicago, and what the anticipated future timeline for this new grant would be, and what it would be primarily funding at the city or in community.
Thank you. Councilmember Khanna has raised a question to the staff associated with the recast program. Is there anybody present who's available to answer those questions? I am not hearing anybody step forward at this time. I wonder if it might be possible to move on to the other two discussion items, and I wonder if the clerk's office can help us contact recast staff to provide an answer to Councilmember Khanna's questions.
Yeah, Chair Fletcher, this is Ken Daler from the clerk's office. I do see Commissioner Musicant is on the call, but I'll reach out to her to see who the appropriate staff is to help answer this question.
That sounds great, although I am about to call on Commissioner Musicant for the next item if we move on. So I will let you work that out behind the scenes, and if nobody objects, we'll set that item aside for the moment and move to item number 5, which is the COVID-19 update, and I'll call on Commissioner Musicant for your report.
Thank you, Council Chair Fletcher, or Committee Chair Fletcher. Just to go back to the previous discussion, the Health Department is the applicant for the new grant, but was not an applicant for the grant that we currently have. And so I can't, with any clarity or wisdom, answer some of the questions about our current grant. So just why I didn't weigh in. But today I am here to talk about our monthly COVID-19 update for the Public Health and Safety Committee. And it's really a momentous time for us to be having this update, as it has been essentially a year since COVID made its appearance, both in terms of the first case. I think we'll go to the first slide if you would, or the next slide. First case and first death in Minneapolis occurred 1 year ago in March. And since March, we have had 400 deaths to date, which is more than 1 death per day, every day for the last year because of this pandemic. And we know that there have been so many disruptions for all of us beyond having lost loved ones, lived through illnesses, but people's incomes have been severely impacted. Their ability to afford food and housing. There have been disruptions of large, massive scale in businesses, just how they go about their businesses, whether or not their businesses are able to operate, the way we conduct schools. And in the midst of all this, there has also been civil unrest in Minneapolis. We are planning to reflect on this year in several ways. One way will be with my next slide, but don't go there quite yet. Nope, not yet. Keep the candle invisible. We are also working with the mayor's office to do a proclamation on March 26th and to ring bells in the city hall tower and to light up the 35W bridge, all on that same date, which is very close to the anniversary of the first Minneapolis death from COVID. And we are also working with Hennepin County on recognition that they are planning as well, so that we're in sync. And then we'll be planning some additional ways to honor some of those in the community that have been so instrumental in helping us get through this pandemic to this point. Later in April, when we celebrate Public Health Week, we'll be having some awards for some of those folks. But one small but important thing that we can do today is just to pause. The pandemic is not over, but I think it does help us to mark time to think about yes, just recognize the tremendous loss that there's been in terms of lives and all who have suffered as a result of this pandemic. So if you wouldn't mind, Mr. Chair, I'd like us to just have 1 minute of silence, and then I will resume my presentation.
Please proceed.
Thank you. Thank you. Let's now go forward and think about some of the statistics of what we have. You can go past the candle. Thank you. So this graph is shows us where we are in terms of infection. The blue line is the city of Minneapolis. We're slightly lower than the state. And as you can see, compared to where we were this fall, the numbers are much lower, but they are actually at a fairly significant rate nonetheless, and they are going up. They have been plateauing and they are going up slightly. So the 7-day rolling average is currently 11 per 100,000. We'd really like it to be significantly below 10. And for the state, it's at 16 per 100,000. While these improvements are encouraging, we feel very tenuous about them because of the new strains that are circulating in Minneapolis as well as across the state. These variants, coupled with increased interactions in schools and through sports and businesses reopening, can reverse our progress. And as we are making significant gains in our vaccinations, we still know that about 80% of our folks have not been vaccinated yet, and so we all need to continue to wear masks and keep social distance while we wait for more of us to be vaccinated. Next slide, please. So part of the positive scene has to do with third vaccination being approved by the federal government. There were limited supplies of that vaccine available right away, and now there's kind of a delay as they engage in more manufacturing. And so right now Johnson & Johnson is not widely available, but it is a very encouraging development, not only because it's a third vaccine, but because it has some advantages in terms of storage, and there's only one dose needed before one is fully protected. There is some difference in terms of protection from these vaccines, but all of them afford really high protection from hospitalization and severe illness. And the CDC is recommending that the best vaccine is the one that's in your arm. So when we have opportunities, I urge you to consider taking whichever is offered to you. The federal vaccine supply is increasing, and this is really, really good. Back in January, they were shipping about 8 million doses per week. They're currently shipping about 15 million doses per week, and that's a 77% increase. We expect another third more to be coming by the end of March. We have been hosting vaccinations clinics. This week we're holding 15 clinics and expect to vaccinate or administer 1,600 doses through those clinics. Just as a reminder, we are one of many vaccinators, and we are using our vaccinations to try and fill in the cracks, but healthcare providers, pharmacies, and large-scale vaccination clinics sponsored by the state are all happening simultaneous with this. Next slide. So a key focus for us is on vaccinating BIPOC communities. For example, we started last week vaccinating in all of the public housing high-rises, and that will be 31 clinics, and those are going very well. We're working with community groups to help us with education and outreach, and even volunteering at the clinics. Other examples of how we are focusing on the BIPOC community, we have prioritized Metro Transit drivers as folks to get some of the early vaccines. We are working in partnership with community clinics, and hope also to be working with BIPOC businesses to do vaccinations, as frontline workers have recently been identified as a priority group, and are planning new community-based vaccination sites that can better serve communities where larger numbers of BIPOC community are in residence. For example, the Davis Center, which has been a testing site, will also now be adding vaccinations opportunities in the North Minneapolis, and Park Avenue United Methodist in the Powderhorn neighborhood is also one of our new contractors for vaccines. We don't have actual clinics planned yet, but those are locations that I think will be great. We are continuing our partnership with the Hennepin Healthcare to be vaccinators, and are adding another vaccinator partner, the Black Nurses Rock. Again, feeling that that will help us expand even further into the community in terms of both capacity and relationships. And we are also working with the metropolitan area on aging to conduct more community-based vaccination opportunities, especially for homebound and disabled seniors. Next slide, please. So this is a new map we just received from the state. We were always working with them to try and get more information about race, ethnicity, who has received vaccine, who has not. So this is a zip coded map, and it shows us the vaccination rate for adults over 65. And so you can see there are several zip codes, some of which cross borders in Minneapolis and are not necessarily entirely in Minneapolis, but who are have received less than 70% of their 70% of their 65 and older have received vaccine. The lowest range is 55%. So seniors across the city are receiving vaccine, but in some communities, the rate is below what we would like at 70%. And so we'll be using this map to target further vaccine opportunities, to work with community clinics to make sure that they have this information. Now we have something also to track our progress and to see where we are going. All right, next slide. COVID testing. There's been a real drop-off in interest in testing, not only in Minneapolis, in the state and across the country, and that is unfortunate because it continues to be still a very important tool, especially as we have these new variants emerging. So we are continuing to offer free testing opportunities, and you'll see them listed there. Columbia Manor, Minneapolis Public School Davis Center, and Phyllis Wheatley Community Center. And if you can help us publicize these, I encourage people to go. That would be terrific. We are also offering free saliva testing kits and on-site testing for schools, community partners, organizations, and businesses. So far, we've received 132 requests for that kind of testing as well. And then there are free at-home testing kits available through the state, as well as the testing opportunities that the state is sponsoring at the Minneapolis Convention Center and the airport. Next. We're working closely with the schools as they begin to expand their in-person teaching. We have provided, we're conducting contact tracing and case investigations for outbreaks. We're providing guidance on their reopening plans. Governor Walz is recommending that students and families get tested every 2 weeks from now through the end of the school year. And so we're hoping that that increases the testing that's being done both by students and their families. And so we are also trying to make the testing opportunities more available to families and students there. We also have prioritized early vaccination clinics for educators and school staff in an effort to make sure that people feel safe and secure. And while most of our efforts are with the Minneapolis Public Schools, we have been also working with charter schools when they have outbreaks or if they have questions, giving them data to help them make decisions. Next slide, please. In terms of resources, I believe at the last committee meeting or maybe even the one before that, you did accept the state grant of $368,000 for us to support some of our vaccination work. It is now in hand, and so we're beginning to spend that. We also anticipate receiving additional federal dollars through the newly enacted American Rescue Plan. Those will probably flow through the state to us, so it may take a bit of time, but some of those dollars are available for contact tracing support, vaccine support, and support overall growth of the public health workforce. And next slide, please, which I think might be my last. So coming up, we do expect a significant increase in vaccinations. We know that increased opportunities also might lead people to be confused about all the opportunities, and we're working with partners in hospitals and health plans and the state of Minnesota and others to try and make sure that we're able to give people clear information about what their opportunities and options are. We're going to continue free community testing events. We are also we have a supply of masks and other protective equipment that we plan to make available to members of the public who might be gathering related to the Derek Chauvin trial. And of course, we will provide ongoing support to the schools as they reopen, and are a little bit concerned about spring break. The CDC does not recommend travel during spring break. Travel provides not only an opportunity for the virus to be transmitted during travel, but it also mixes people from different places. And so if you haven't solidified travel plans, we encourage you to put those off. And then, as I said earlier, in April, during our celebration of Public Health Week, we will be honoring community heroes who have helped us get as far as we have gotten in addressing the pandemic in April. So thank you. I'll stand for questions if there are any.
Thank you for that presentation, Commissioner Musicant. Are there any questions from my colleagues? Seeing none, I'll just ask one question myself. I know I've gotten a couple of questions from constituents as they've been contacted by their clinics about how people are accessing vaccinations if they don't have a regular provider who would know to contact them. And I think that's particularly salient for the unsheltered homeless population in our city. I'm really appreciative that you're doing the work you're doing in public housing and in some contexts. But I'm especially curious about how people who are in the shelter system, how people who are in transitional housing are getting access to vaccines, and particularly given that their heightened risk of exposure.
Yes, thank you, Chair Fletcher. We are working with Hennepin County, and because they have quite a robust healthcare for the homeless program, they have agreed to do vaccination of unsheltered homeless population and the homeless population that might be in shelters. And so that is an effort that's already happened, round one, and will continue to happen as new individuals are identified in that population. In terms of if people don't have a healthcare provider and yet are either already eligible for a vaccine or hope to be soon, the state does have a registry that we encourage people to go and put their name in. It will help you identify when you are eligible. It will inform you when your category is eligible and do some help in providing opportunities about where you might find vaccine. It's not a panacea in terms of finding the vaccine, but it's a very good resource to make sure that you're on the list and you know when you're eligible, and you have that to take with you to any of the clinics like we are providing or that pharmacies are providing, and to some extent the community clinics are providing to people who aren't their patients at the present time, but are eligible nonetheless.
Thank you. Councilmember Kano has a question.
Hi there, can you hear me?
Yes.
We can.
Okay, great. So I just wanted to go back to the recast conversation. Thank you for addressing it, Commissioner Musicant. Yeah?
I'm sorry, Councilmember. We'll come back to that after we receive and file this presentation, but we're still on the COVID presentation at this time.
Oh, I see. Okay, I thought it was.
I'll call on you for that as soon as we're done with this.
Okay, thank you.
Perfect. Good. I don't see any other comment on the COVID-19 update, so I will just reiterate our gratitude to the health department. Thank you for helping us mark the occasion of some tremendous losses that our city has suffered. Thank you for helping us avoid those losses moving forward to the extent that you have. And we are excited to be, as you said, getting shots actually in our arms and getting back out into community with each other, thanks in no small part to the work of you and your department. So thank you, Commissioner Musicant, for this presentation and for your work. Without objection, I will order the clerk to receive and file this report. That is filed, and we will move back to item number 1. I understand that Noya Woodrich is now on the line to respond to Councilmember Kano's question. I'll call on Councilmember Kano.
Thank you, Mr. Chair. Apologies about that. I had heard the commissioner address recast, so I thought we could just kind of go back to that. So thank you for keeping order here. Yes, either to the commissioner or to the to Ms. Woodridge. Curious about if there's supports or services available through Recast Now for the communities at 38th and Chicago. I know that there's a network of healers and trauma response community members who are engaged, but I'm not quite sure how we can resource them. Specifically, you know, I reached out to Resma Menachem and to Suzanne Keplinger at Catalyst Minneapolis Foundation, and they are connected to several people that they have been working with to train and to share strategies of trauma response. And certainly when I've been in touch with the folks at 38th in Chicago, they have expressed that, you know, they're at capacity. They're very much involved in responding to interrupting the violence that's happening, but there's not a lot of support or personnel or people available that are trained in whether it's psychological first aid or cultural somatics or other types of trauma response to the body and to the bodies who are there on site, experiencing and watching and absorbing everything that's happening there. So I knew that we had some monies at the city that did trauma response and would be really curious about how those resources are being aligned and directed to the site, to the area of 38th in Chicago and leveraging our existing partnerships there. And then would also love to hear what your thoughts are about the grant for the future. I wasn't aware that we were switching the home department. I thought this money was parked in the city coordinator's office, but I'm not sure. And so would love to hear if the health department is taking it on next, sort of what does that mean for the grant? It's like I mentioned before, it's a pretty sizable grant. It's a pretty meaningful body of work, and it would be great to know what your anticipation is for that future body of work. Thank you.
Thank you. I'll call in Ms. Woodridge. Welcome.
Councilmember Cano and Chair Fletcher. Yes, the current recast grant sits in the coordinator's office with the Office of Race and Equity, and that grant runs through the end of September of this year. The one that we applied for would start in October of this year if we are successful in receiving it. I can't speak to any work that the Office of Race and Equity is doing with the recast grant during these times, particularly at 38th in Chicago. But we were on a meeting. I was part of a meeting this morning where we were speaking with Vault Health. Vault Health is the group that is doing the testing. That's why that name the COVID testing, I should say, that name might ring a bell for some folks. They are interested in working with the city to respond to the trauma and mental health needs of community members and everything that they are experiencing right now. So there are going to be some ongoing conversations with them. And those conversations include both the coordinator's office and the health department. For the grant moving forward, when I was approached by community expressing an interest to work with the city on making the application for the recast dollars, I approached Joy Marsh Stevens in the coordinator's office, the Office of Race and Equity, to inquire as to whether or not they were going to reapply for the money. And after some discussion, they decided that they were not going to reapply, and so that opened the door for the health department to apply. And the proposal that we submitted is very community oriented. So if we were to receive it, it would be $1 million a year, $750,000 of which would go out to community. The city, we would be responsible for coordinating some of the training that is required as part of a recast grant. But really all of the trauma and mental health work would be done and based in community. And if you've read the proposal, you will notice that there is a heavy emphasis on the Native community. But I will also note that the recast, if we get it, is 5 years. And with each subsequent year, we will add another cultural community to the programs so that we ensure that we are serving and positively impacting all of the communities in Minneapolis that are experiencing trauma, particularly due to the civil unrest that we've experienced in the last year.
Absolutely, I understand, and thank you so much for your leadership in submitting that application. I was involved in a similar process where we had hoped to submit a very large grant request to re-grant to community, but we did not have the wherewithal and the stamina to complete that process, so I commend you for fighting for these resources for community members who oftentimes don't have the capacity to compete for such large grants. So I appreciate this update. Thank you for letting me know about the future work. I look forward to supporting that in the best way that I can. And then I'll loop back with the city coordinator's office about sort of the now and the needs we should be meeting today. Thank you.
Thank you. Councilmember Kano, would you like to move approval of this item?
Yes, I would. I would like to move approval of this item.
Very good, and I will second. Is there any discussion? Clerk, please call the roll.
Councilmember Gordon,
Aye.
Councilmember Ellison,
Aye.
Councilmember Kano,
Aye.
Councilmember Palmisano,
Aye.
Vice Chair Fletcher.
Aye.
There are 5 ayes.
That carries, and the motion is approved. That brings us to our final item on today's agenda, which is a discussion item on the public safety transformation alternatives and policy analysis update. Presentation by Andrea Larson, Gina Allen, Renee Youngs, and Mwanya Anyuke. I will hand it over to you.
Good afternoon, Chair Fletcher and council members. I'm Andrea Larson, the Director of Strategic Management in the City Coordinator's Office. I'm here with our team today, which you just listed, many of us present, to provide our Q1 update on the work around alternatives to police response, but also on a couple of policy analysis areas that our team is leading. Next slide, please. First, we'll provide some updates related to the overall public safety transformation work, which includes our office, but some others around the city as well, including 2 of the studies and work we're doing developing theories of change. And then we'll provide updates for each of the pilots and projects that our office is leading and supporting. Next slide, please. And then the next one after that. Before we start, I just want to orient us around the public safety transformation framework, including the 3 pillars of transformation, prevention, alternative, and reform, and the work across and within the pillars, engagement across the top, and policy analysis across the bottom. So we're going to start by providing updates on a couple of projects in the policy analysis bucket that our team is leading. And for that update, I will hand it over to Renee Youngs.
Thank you, Andrea. Thank you, Chair Fletcher, members of the committee. Good afternoon. I'll ask the tech team to advance 1 more slide, please, and I will talk briefly about this first item is a tool that we anticipate being of use to and supporting the work of staff in all of the areas of the Transforming Public Safety framework that you just saw a moment ago. It's a tool called a theory of change, which is a little bit of a term of art, but what it really means is a visual model, a representation of work that is happening. It's intended to show the results that are intended from a set of actions, programs or initiatives or other interventions, as well as how and why those actions are expected to achieve the stated results. Next slide, please. Why are we doing this? Well, the long story short is that a theory of change can be a very useful tool for a number of different purposes. It can help us to identify the goals of an initiative and importantly, to communicate them really concisely to stakeholders, both internal and external to the activities that are happening. It can also help us prepare for evaluating the results of our work by helping us have a really clear understanding of what success means and whether some of the dependencies and actions along the way are happening that are necessary to make results happen at the end of a set of work, and all sorts of other uses. So hopefully this should be a tool that is applicable both for staff who are completing transforming public safety work, as well as a number of other stakeholders whose experiences are touched by the process. Next slide, please. So what a theory of change is, a little bit more technically, it has a particular structure, although it does not need to look the same in every instance. What it is primarily intended to do with its structure and function is to show the relationships between the intended results of a set of activities or programs and all of the other components of setting and action and resources that go into achieving those results. In some cases, it's a model that literally connects dots and draws arrows between the resources and activities in play and the results that they're expected to lead to. Next slide, please. So we're working to draft a theory of change with key staff in the 5 areas of work that you saw in the Transforming Public Safety Framework. That again is prevention, reform, alternatives, community engagement, and policy analysis. What you see on the screen in front of you now is a rough timeline of that work, work that's been completed to date and work that we expect to complete in the next month or so. We're focusing on working with key staff in the areas of the framework because it's critical to make sure that the document, at least initially, is fully representative of what our subject matter experts understand the work and the intended results to be. By design, theories of change are living documents, so we can and arguably should expect to see them evolve or be revised as programs or initiatives change, as the nature of the work evolves, as new needs or new contextual factors emerge. So what we might see out of this process in the spring of 2021 is not necessarily the model that we are committed to for the rest of time, but it's a really important starting place to begin with our subject matter experts and their understanding of their work. Next slide, please. Excuse me. Very briefly here, you see a hypothetical example of a theory of change to give those of us who are visual thinkers a sense of what I'm talking about. This is a representation of a fictional tobacco cessation initiative, and you see the set of boxes in the middle, something very much like transforming public safety, a number of different distinct initiatives that all together are building toward a bigger set of results that all have at their core a set of resources coming into them that may be shared, may be distinct among the initiatives, but that all are pulling together to reach the same result within a shared context. This is what a theory of change expert might call a nested theory of change, and we expect the final product for transforming community safety work to look something generally like this sort of nested model to highlight the different initiatives as well as the big picture objectives of all the work together. Next slide, please. I will change, with apologies, I will change gears quite abruptly now and talk about a second project in this area of public safety work, the Minneapolis Police Operational Assessment. You may have known this work previously as being related to 2 separate requests for proposals and scopes of service that had been called the MPD Staffing and Efficiency Study and the 911 Problem Nature Code Prioritization Study. These 2 scopes of service were combined through a waiver process because one of the solicitations did not result in potential vendors that were sufficiently strong. And the other solicitation resulted in a vendor that was quite strong in skills and experience in both scopes of service. So very conveniently for us, it worked out to amend the scope of service and amend the contract to put it together with a single vendor. So the two generally pieces of work for this project are to conduct a workload-based staffing analysis for how we meet the demand for service that is currently experienced by all areas of the Minneapolis Police Department, and to review the use and prioritization of problem nature codes. Problem nature codes are the codes that are assigned at dispatch when a 911 call comes in to describe the nature of the problem. I want to note a few things about this project at a very high level in terms of what we're expecting from it. The study ultimately is not expected to give us a single concrete perfect answer about the number of officers MPD should have, nor is it expected to show us exactly, concretely, specifically what public safety functions MPD should or should not perform. It will, we expect, give us some recommendations on both of those topics, but it will be one of a number of tools and considerations that city leaders and policymakers will have at their disposal in making those decisions. Timing-wise, we expect to receive those recommendations and results from the project sometime in the fall of 2021. I think early in the fourth quarter is when we can expect to hear publicly those results. And as you know, that will be partway through the city's 2022 budget process. I'll also note one other thing you see on the slide here. We have made publicly available on the city's website the timeline for the city's community safety work of the full set of contract documents and scopes of service and information about the vendor, so that members of the public can review that at their leisure. Next slide, please. So what will this study do? I spoke briefly about what we expect in terms of results. We have a little bit more detail about results on this slide. What we do expect, I've told you what we do not expect. What we do expect is to understand a sense of the total personnel needed to meet the city's service needs for public safety, and some ideas about where and by whom various services could be provided. There's not likely to be a single obvious or optimal result, so there will be, I'm sure, more factors that will need to be weighed in addition to the results of the study, but hopefully it will help us along the way to making those decisions. Next slide, please. I wanted to highlight briefly that there are staff all around the enterprise who are serving as points of contact for this project. This means that they have made themselves available graciously to participate or give input as needed. For instance, folks who are the managers of a particular data set that is needed for the analysis, or people who have other subject matter expertise that may factor into how a recommendation gets framed down the road, or who may be needed to pull in by the vendor's research team for an interview to obtain qualitative data. Next slide, please. Currently, we are gathering primarily existing data, a lot of quantitative data, and you see some examples on the screen here. We are working, and I particularly want to highlight the role that the city's information technology, data and analytics services team has been playing in helping me as a lowly non-IT expert contract manager to help identify data sources and the critical data fields within those sources and the owners of those data sources to help us understand what we have and what we can provide to the vendor. We've been working together with subject matter experts, data owners, and IT to prioritize the different data sources, understand what we have available for the vendor, and get those sent off to the research team to begin their analysis. Next slide, please. There is another thread of work happening to respond to requests by the vendor to gather data for their analysis. And that is non-quantitative data sets in the form of operating documents to understand essentially how business is currently done around public safety, as well as setting up interviews with key personnel, some of whom will be within MPD, many of whom perhaps will be within MPD, as well as other departments around the city who have expertise or capacity relevant to public safety services. We've also been getting tremendous support from staff within 911 to also assemble documentation and information about problem nature codes and about the experience of dispatchers in terms of demand for public safety services. Next slide, please. Finally, a brief rundown of future actions and what you might hear in future quarterly updates on this project. The vendor will be working through these data sets and completing their analysis on a rolling basis as data become available through the second quarter of 2021. And then we'll be working to draft a report and share draft recommendations. City staff will review those. That all will happen, we expect, in the third quarter. And then from the end of the third quarter and into the beginning of the fourth quarter, we can expect final reporting and dissemination, including coming back to this committee or other council committees, or wherever you wish at your discretion to share the final product of this work. Those are my updates for today. Next, my colleagues will be sharing updates about the Office of Performance and Innovations work, piloting and implementing alternative emergency response services. I will be here in the meeting and available to stand for questions at the end of their presentation. Thank you all.
I see Councilmember Gordon has a question now. Would you prefer we wait till the end of the presentation for questions, or should we?
Oh, as you wish, Chair Fletcher.
Very good. I'll go ahead and call on Councilmember Gordon.
I appreciate that. I do have some notes and might have been able to wait, but it might be more timely to get it here. I have three, I think, questions, or maybe two questions and one suggestion. I was curious about when we went out for the two contracts, you said we got no response to one and then a response to the other that looked like they could meet both of our needs. Which contract were they responding to?
Yes, Chair Fletcher, Councilmember Gordon, we received, I believe, 8 responses to the staffing and efficiency study solicitation, all of which were relatively robust. I believe we received 2 responses to the problem nature code study. I was not managing that process, but my understanding is that both were insufficient for the city's needs for the problem nature code study.
That makes sense, and the problem nature code study seems smaller, so that's good information to have.
If I could, Chair Fletcher, Councilmember Gordon, I'll just add one thing. We did receive 2 for the problem nature code study. Both were not a great quality and also well over our budget. So that made it an even easier decision.
Well, and given these times, I think we, the table where I sit, always like to hear that we maybe saved a little money. So
we did save money.
That's another plus. That's another plus. I also wanted to ask if there's been any discussion in terms of doing the study of interviewing former employees. I think sometimes we can get really valuable information, and I'm sure that both in the police department and in 911, we've even had some leadership who's retired. We have some former chiefs who probably and division heads or directors that have probably have ideas about improvements that could be made. And we also probably no doubt have some rank and file 911 dispatchers who we might be able to reach back to and see if we can get an interview, and the same with officers. It's just difficult, I think, sometimes for us to get as open and free and relaxed responses to some questions if people are worried about the work climate they're currently in, if that makes any sense to you, and I think it should make sense to pretty much everybody. So is there any effort to do that you're aware of, or could my question influence you in that direction?
Councilmember Gordon, I must admit I am not aware of how our selected vendor normally does this, but my impression is that they are very committed to being responsive to our expertise within the city of what we think they should draw from in terms of both quantitative data sets and the right humans to provide insight. So I don't know if that was on their radar, but I have literally uncapped my pen and I will be making note of it to make sure that it's on their radar as well. Thank you.
Great, I really appreciate that. I'd also like to just plant the seed that maybe when the results come in Q3, this would be worth a study session. I'm not sure how robust the results will be, and I'm not sure how different and divergent the optional recommendations might be, but it might be the kind of thing where we just want to have a meeting where we're not making any decisions, but where we can get all the information. I'll put that out there for folks to consider, and you'll know better probably if I'm right when we get closer to what those results are and the recommendations. And thanks for your time and allowing me to interrupt the meeting.
Very good, and I agree that this will certainly be worthy of a study session or other kind of focused meeting on this topic when we get the report back. Thank you, Councilmember Gordon, and the presenters can proceed. Thank you.
Thank you. I'll come back and jump in here. Next slide, please. So coming back to the framework, we're now going to provide some updates around the alternatives pillar and work that we're doing there. Next slide, please. This is an overview of the various projects that our team is either leading or supporting and what we will be providing updates around today. Next slide, please. Here you can see the projects in their various stages. Some of the projects are well along their way in planning, and a couple of the projects are in pre-planning, meaning we're organizing the people and prioritizing the work to launch the planning phase. And I'll say a little bit more about that. Next slide, please. So first, I'm going to take a few minutes, and I'll jump through these slides pretty quickly before our pilot updates, but to review a new working structure the team is implementing to move these various projects forward. Starting March 2021, so this month, the Office of Performance and Innovation will transition to a project-based working structure for the alternatives to police response work. This structure is a reorganization and reprioritization of work from the former 911 MPD work group. The 911 MPD work group structure was a really useful collaborative structure for brainstorming and vetting ideas and putting recommendations forward. And this new structure allows OPI staff to engage more deeply and purposefully on work required for implementation. So now I'll walk through a couple of the different structure slides. Next slide, please. So the projects fall into two categories, which impact the working structure we'll use to complete the projects. There are several projects on which the Office of Performance and Innovation team is taking the lead, and a handful of projects where the operating department is taking the lead. It loosely followed where the dollars went, so if the budget was allocated to our department, we are taking the lead, and departments, SMEs, are supporting and sometimes co-leading that work with us. And if the dollars went directly to the department, then they are taking the lead, and we are supporting and co-leading the project with them. And so I'll walk through the two different models that we have for each structure. Next slide, please. We're using a Racy model to establish role clarity within the project. And so this slide just shows the definitions of each of the roles, and they're color coded. You'll see the colors applied to the working structure in the next slide, please. Yeah. So.
It sounds like there might be someone who's unmuted. If you can mute yourself if you're not presenting, that would be great.
So this is the working group structure for projects where OPI is the lead. We have it organized as a hierarchy that was sort of the clearest visualization I could find to depict the structure, but we will be depending on many people across the organization to support and occasionally lead various elements of the project. Next slide, please. This is a different version from the prior slide, which just shows more detail about who within the organization will be working and outside the organization will be working with and depending on for implementation of the various pilots and projects. Next slide, please. And lastly, this illustrates the working structure for projects where the department is the lead and OPI is providing the support. It loosely follows a similar structure as the OPI lead model, but there are fewer projects in this category. Any questions on the revised working structure before we move on to the project updates?
I don't see any. Go ahead.
Great. I'm going to turn it over to Gina Allen to kick off the pilot updates.
Thank you, Andrea, and Chair Fletcher and council members. I'll now get into the specific updates on each of the pilots and other initiatives. Next slide, please. As a refresher, this slide shows the reporting structure that we'll use for each of the projects. And in each of those color blocks, you'll see some of the examples of the type of information you can expect depending on the pilot. Recommendations down at the bottom will come later in the year, sometime in Q3 or 4, depending on that specific pilot. And as we progress with our council updates throughout the year, you'll see that each of the template slides is continually filled in with additional information as more work begins and is completed. Next slide, please. This timeline here outlines our council updates for each quarter. What we'll primarily be going over today are planning updates, when we expect the pilots to launch, and the updates you've already heard about the MPD operational assessment. Next slide, please. Our largest scale pilot is the creation of the mobile behavioral health crisis response teams. These teams will provide an unarmed, highly trained, and supportive response to behavioral health crisis calls. I do want to highlight that since our January update, we have switched the language to behavioral health because we feel that it casts a wider net for the types of incidents that the teams may be responding to. And my apologies that the language was not updated on this slide. The RFP to find those community providers that we will partner with was opened on March 1st and was originally set to close on March 31st. This past Thursday, we had a very well attended and exciting pre-proposal conference call with providers to come hear more about the initiative and to ask questions that they have. And after that, we decided to extend the close date of the RFP by 2 weeks to April 14th, just to allow providers a little more time to complete their proposals. And this also does extend our estimated launch date of when services will go live to June 15th. Just want to give a note to providers who may be watching that you can go visit the city's Doing Business with the City webpage and click on Go to eSupplier Portal to view the RFP. And as of this morning, I know it says 2 on the slide here, but as of this morning, we have received 5 notifications of intent to apply, with one of those being a coalition of community organizations who are partnering together to complete their proposal. So that is super, super exciting. And we are working with our project team to develop the eligibility criteria for 911 calls that those teams will be responding to and how best to triage them. And in the green box here, you'll see some of the anticipated metrics that we may be tracking during the pilot. Next slide, please. To support our 911 staff with having a new response option to dispatch, emergency mental health dispatch training will be provided. And the work on this is underway with meetings planned for 911 representatives to meet with other PSAPs or other 911 centers, and then the training providers to learn about their experience and what to expect from the training. and be able to ask questions directly from their perspective of the folks who will be triaging those calls. And we expect those trainings to begin sometime during the second quarter. Next slide, please. Another area of support for triaging eligible calls for our mobile crisis team response is embedding mental health providers in 911 to help 911 staff with that triage process. COVID has presented a barrier to our ability to do sit-alongs with 911 staff to gain a better understanding of what happens when a call comes in, to help us try to figure out the best way to insert those mental health providers into the process. And the project team is currently trying to figure out a way to work around that. We will also be releasing an RFP to find community providers who are interested in partnering with us to provide this service. And we will begin drafting that sometime within the next month or so. Next slide, please. The fourth pilot related to mental health crisis 911 calls is providing de-escalation training to community members through a micro grant program, which is planned to use a train the trainer type of model. And this pilot is housed in the Office of Violence Prevention, and OPI will be providing support. The pilot aims to increase our community's ability to support one another when someone is experiencing a crisis. And if someone does have to call 911 to request support, we want to make sure that community members are able to give 911 call takers all of the necessary information to make sure that the right resources are able to be dispatched at the right time. Planning work on this will be underway in May, and that's the end of the updates I have for you. So I'll now hand it over to Mwanya Anike to discuss the updates relating to non-emergency reporting calls.
All right, thank you, Gina. So as Andrea had mentioned, we have some of these projects that are department led while the Office of Performance and Innovation is supporting. So because the next recommendation that we're going to be talking about for the report recommendations is department led, I'm going to call on Trish Glover from 911 to give this update. Sorry, from 311.
Good afternoon, Chair Fletcher and council members. I'm happy to give this update today. As you're aware, this pilot involves 911 transferring non-emergency report only theft, property damage, and parking problem calls to 311. By doing so, this is going to free up 911 and MPD by decreasing their call volumes, allowing them to focus their efforts on emergencies and high priority crimes. We were able to hire 9 people that started in January. Sadly, we lost 2 of them. And I'd like to just state that because we had to do the entire hiring process virtually, we were not able to have applicants sit with agents. Normally when they're done interviewing, we have them sit with an agent for 2 hours so that they see what the job really entails. One of the applicants quit after 2 weeks, and another one we had to let go, but we also have an employee that surprised us with a early retirement that's going to be April 3rd as well. So that puts us down 3 again, but we are still training. Training is moving forward. We have moved all the agents home, so we are doing training virtually now as well. So that makes it a little bit more difficult. We're hoping to have training finished by the end of May to early June, and that is just because of the barriers that we've hit with having such a large class and having to go remote. I think that just adds a little bit of slowness. And my training analyst, the one who is not training, is actually building the training as she goes. When we had our upgrade with our Lagan system, and then the Microsoft 10, it threw everything out of skew, and so we had to redo everything. So she's working on that as she's going to. So that's not slowing anything down. It's just adding to everything that's going on at one time. So right now we're looking at early May to early June to have all these folks trained up. That's what I have for today.
Thank you, Trish.
You're welcome.
Next slide, please. So the next recommendation that we're going to be looking at for implementation will be conducting the awareness campaign about the reporting options that are going to be moving to 3-on-1, but the awareness campaign is also going to cover a little bit more than that. It's going to be trying to cover a host of the recommendations that the team is working on. This way, residents are aware of all the different changes that are coming to the city services. And for this recommendation, we have started working with communications to build an internal project team. So we are starting to think about the different language and the target audiences for the messaging in order for us to have the most effective messages for the different communities in Minneapolis. So that work is underway. And in addition to that, we are also looking to use behavioral science methods to see which form of communication is kind of the most effective. So that is something that will be a piece of this as well, and it will be a part of the evaluation of how well the communication, of how well our awareness campaign worked. Next slide, please. So training non-police city staff to take theft and property damage reports and collect evidence. So for this project, we are currently building an internal working group. We're building an internal project team. This project is very, very early in the planning stages as we are trying to identify what city staff would be taking on this role. Next slide, please. So this is the transfer of all parking related calls to and responses to traffic control for the overnight shift. And we're currently looking at piloting this. And as I mentioned before, this is a department-led project. So I will be calling on Kim Keller from Regulatory Services to give this update.
Thank you, Mwanya, and thank you, Chair Fletcher and council members for inviting me here today. I'm Kim Keller, Director of Regulatory Services. As Mwanya recapped the pilot, we are looking to expand traffic control's hours of operation so that they can respond to these overnight parking related 911 calls. The change frees up MPD capacity and reduces interactions between law enforcement and the public. We recognize that implementing this pilot, after all that our city has gone through over the last year and continues to face today, is a different endeavor than when it was first identified as a project. And the project team is responding to that reality in multiple ways. We've established a project team that is staff heavy and inclusive of many lenses. Specifically, we sought BIPOC and female staff members as well as a union perspective. We've also drafted a racial equity impact assessment alongside more traditional project management documents, and we'll continue to utilize and update it as the pilot progresses. We're taking a deep dive into the associated data to better understand where and when the parking calls are originating, as well as public safety considerations. And the deep dive has had a secondary benefit in that we've realized that in addition to 911 calls, these agents should also be able to address some overnight 311 complaints that are coming in through the app, and that will lead to better overall service for our residents. We're also in the process of working with 911 and MPD to better understand their staffing models and operations. Next slide, please. As we better understand 911 and MPD capabilities, we'll be able to establish our staffing model. The shift schedule is close to being determined, and once that happens, we should be able to post for the roles. And then while the hiring process proceeds, the project team will be focused on staff readiness, included needing training and support infrastructure for an entirely new shift. We also look forward to a communications campaign around the pilot and ongoing engagement and feedback post go live. And those are my remarks. I'd be happy to turn the presentation back over to the Office of Performance and Innovation.
Thank you, Kim. Next slide, please. So with that, that concludes our presentation. Thank you all for your time, and we are open to any questions that you have.
Thank you for that presentation. There was a lot of terrific information there. I see Councilmember Gordon put himself in queue. Councilmember Gordon.
Thank you much, and thanks for all this information. As things were going by, it was clear that there'd be lots of budget implications for all of this, and maybe especially the last one. And I'm trying to figure out how the timing's going to come so that those recommendations can be have the potential to be part of the staff recommendations that go to the mayor's office as he's formulating his proposed budget. And I don't know if I suspect most of the department heads involved with this have been thinking about this, but I just wanted to call it out. I know with some of the things we're saying, the recommendations will come in about the budget one slide in November. And of course, for that to get into the proposed budget is way too late, but that should be happening too. We want recommendations as long as we can and budget implications. So if anybody wants to talk about that a little, that would be just fine. I would say from our perspective on the council, it's really valuable to get kind of recommendations from staff in the summer before August, so we are also understanding what's coming forward. I'm happy to leave that as a comment if everybody just wants to sit on it. Thanks.
Chair Fletcher, Councilmember Gordon, I'm happy to jump in on that. We have been and will continue to be in conversation with the mayor's office about how to think about holding some dollars, understanding that there may be budget implications from these projects. I do think it's important to note that the estimates that we worked on last year and that were embedded in the budget long term, I think will cushion the shock of some of the changes. And so, but that's a great suggestion and something that we're definitely thinking about.
Thank you. It looks like Director Keller also has a comment.
Thank you, Chair Fletcher, and thank you, Councilmember Gordon, for bringing that up. It is a really important consideration for the pilot that I discussed. The funding that was approved in the 2020 budget is considered ongoing for those 4 FTE, 3 agents and 1 supervisor. So that does help us, at least in this one pilot, to be able to move it into ongoing operations with the potential for expansion in the future.
Oh, thank you so much. That's good clarification to have. I'm relaxing a little bit already.
Thank you. And that certainly was our intention in the budget process. And I just want to add my appreciation for all of the terrific work on display here. I think it's really important. People want to know, you're talking about transforming public safety. What's the city actually doing? And this is the real tangible steps that we took in the budget that we've been developing over time, that we're putting into practice and into action. And I'm really appreciative of this update. I'm looking forward to future updates once a few of these things are actually out in the field. And just want to wish you continued success as you develop these programs. We are watching carefully and we care a lot about these outcomes. We think this is going to be very impactful work for the city. Are there any other comments or questions from my colleagues? And Ms. Larson, did you want to say something else?
Just wanted to say thank you for that comment, and that I echo that we have the best team ever we get to work with, and our department partners have been really great. And so just want to echo that gratitude publicly for all of our partners in this.
Thank you. That's a great note to end on, and seeing no further comment, I'll direct the clerk to file this report. That gets us to the end of our agenda. So without objection, I will declare this meeting adjourned. Thank you, everybody.